Hey everyone, and welcome to the PTCB Prep Guide. If you're getting ready for your pharmacy tech exam, you are in exactly the right place. Today, we're jumping into the musculoskeletal system. We're going to cover the key definitions, the must-know meds, and some real-world examples that'll help you absolutely crush it on test day. So, here's our game plan. First, we'll tackle common injuries. Then, we'll get into the more serious stuff like bone infections and osteoporosis. After that, we are going to decode the 3 main types of arthritis you've got to know. And we'll wrap it all up with a quick-fire review of muscle relaxants that I promise you will see on your exam. Let's do this. All right, first up, let's dive into the injuries you're pretty much guaranteed to see questions about. We're talking strains, sprains, and fractures. And we're really going to focus on telling them apart and knowing which drugs are used to treat them. Okay, here's a super simple memory trick that could honestly be a lifesaver on the exam. A strain involves a tendon. Just think, T is for tendon. Super easy, right? That means a sprain is a tear in a ligament. Knowing this one little difference is so crucial, so lock that one away. Next up, let's talk about spasms. You know that feeling when you get a muscle cramp that just will not let go? That's pretty much a spasm. It's your muscle contracting when you don't want it to for way too long. Sometimes it's from working out too hard, but it can also be a little warning sign that your body's trying to make up for a deeper issue with a bone or a joint. Now for fractures, you really need to know these 4 types. A simple or closed fracture is just what it sounds like. The bone is broken, but the skin is still in one piece. But the one you gotta watch out for is the compound or open fracture. This is where the bone actually breaks through the skin. This is a huge red flag because the risk for a nasty infection goes way, way up. The other 2 are pretty straightforward. Complete means the bone is snapped into 2 pieces, and incomplete is more like a crack that doesn't go all the way through. Okay, so what are we using to treat the pain from these injuries? These are the big players you have to know, and I mean both generic and brand names. So you've got ibuprofen, that's Motrin or Advil, and naproxen, which is Aleve. Notice those are your over-the-counter anti-inflammatories. Then, for the really bad pain, you have the heavy-duty prescription opioids like oxycodone and morphine. Knowing which is key. All right, let's shift gears and move into some of the more serious long-term conditions. We're talking about bone infections and what happens when you start to lose bone density. Osteomyelitis, this one is no joke. It's a really bad infection that gets inside the bone itself. Now, for your exam, you need to connect 2 big things here. 1, it's a major complication for patients with diabetes, especially in their feet. And 2, it's so serious it needs long-term, powerful IV antibiotics to treat. If it's not treated right, it can literally cause the bone tissue to die. So what are we using to fight that kind of infection? We're bringing out the heavy hitters. You'll definitely want to recognize these names like cefazolin and especially vancomycin. Vancomycin is a go-to for really serious infections that other antibiotics can't handle. Just being able to associate these drugs with osteomyelitis is a huge win on the test. Now, osteoporosis is kind of sneaky. They call it a silent disease because you don't feel it happening. Think of your bones like a construction site. You're always breaking down old bone and building new bone. With osteoporosis, the breakdown crew is working way faster than the building crew. This leaves your bones weak and porous, making them super easy to fracture. And a huge risk factor the exam loves to ask about, post-menopausal women, all because of that drop in estrogen. All right, little pop quiz for you. Before I flip to the next slide, what's the #1 class of drugs that pops into your head when you hear osteoporosis? Think about it for a sec. Yes, if you said bisphosphonates, you absolutely nailed it. And here's the best memory trick for these on the exam. Just look for that dronate suffix. Alendronate, ibandronate, rhizadronate, they all end in dronate. And you definitely have to know their brand names too. Fosamax, Boniva, and Actonel. These are for sure going to be on your test. Okay, everybody listen up, because this is a massive red flag safety warning and a classic exam question. This is one of the most important counseling points a technician can help reinforce. When a patient takes a bisphosphonate, they have to take it with a big, full glass of water, and then they have to sit or stand upright for at least 30 minutes. Why? Because if that pill gets stuck in their throat, it can actually cause severe chemical burns to their esophagus. Staying upright makes sure it goes straight down to the stomach where it belongs. All right, let's pivot to our third big topic, arthritis. Now, arthritis is a general term, and it's super important to know that not all arthritis is the same. We're going to break down the 3 key types you'll be tested on because their causes and their treatments are totally different. Let's start with the 2 big ones. First, you have osteoarthritis. Think of this as wear and tear. It's like the tires on your car getting worn down after years of driving. It happens over time. Rheumatoid arthritis, on the other hand, is completely different. This is an autoimmune disease. Basically, your body's own security system goes haywire and starts attacking your joints. It's a case of friendly fire. Understanding that core difference is everything. So, because rheumatoid arthritis is an attack by the immune system, the drugs we use have to go after the immune system itself. That's why you see these more complex drugs called DMARDs, like methotrexate. And you'll definitely see the biologics, like adalimumab, brand named Humira. These are really powerful drugs designed to calm that immune system attack down. Now, compare that to osteoarthritis. See how different the treatment is? We're not trying to suppress the immune system here. We're just trying to manage that wear and tear pain and inflammation. And that's why we see our familiar over-the-counter friends like Tylenol, Motrin, and Aleve. The treatment strategy completely matches the cause of the disease. And our third type of arthritis is gout. This one's a whole different beast. Imagine tiny, sharp, needle-like crystals building up inside one of your joints. Ouch! That's what happens with gout. It's a buildup of uric acid. And for the exam, there's a classic trio you have to remember. Gout, uric acid, and the big toe. That's its most famous target.
So how do we treat it? Well, there are two different game plans, and you need to know both. Think of it as offense and defense. Your long-term defense is allopurinol, or Xyloprim. It works to prevent attacks by lowering the amount of uric acid your body makes. But when a patient is having a sudden, painful attack, a flare-up, that's when you need the offense. That's your put-out-the-fire drug, colchicine. Knowing which one's for prevention and which one's for an acute attack is vital.
Okay, we're in the home stretch now. Let's wrap this all up with our final section, a rapid-fire review of muscle relaxants. I can pretty much guarantee you will see these on your test, so let's make sure you know them cold. Okay, take a quick look at this table. Cyclobenzaprine, which is Flexeril, Carisoprodol, which is Soma, methocarbamol, Robaxin. Do you see the pattern? What's the one thing they all have in common? Drowsiness. This is the #1 most important counseling point for this entire class of drugs. It's a huge patient safety issue. Anyone taking these meds needs to be warned not to drive or do anything that requires them to be alert. As a technician, this is a critical warning to flag. So as we finish up, I want you to think about this. It's not just about memorizing names for a test. It's about understanding why this information matters. How will you use what you know about a side effect like drowsiness to actually keep a patient safe? Thinking that way is what will make you a truly great pharmacy technician. You did an awesome job getting through the musculoskeletal system today. You are absolutely on the right track for your exam. Make sure you review your notes, rewatch this if you need to, and just keep practicing those drug names. If this helped you out, please give it a like, subscribe, and share it with anyone else who's studying. We're putting out new pharmacy topics every day to make this whole process easier. Keep up the great work. You've got this.